Brucella. The genus Brucella consists of a small, non-motile, aerobic, gram-native cocoa bacilli, which are strict parasite of animals, goats, sheep, cattle, pig, buffalo. Man acquires infection by contact with the infected animals or through their products. The human diseases had been known under various names such as Mediterranean fever, Malta fever, and undulant fever. Morphology: Brucella or gram-negative non-motile cocoa bacilli or short rods measuring 0.5 to 0.7 micrometer into 0.6 to 1.5 micrometer. They are arranged singly or in short chains. They are non-sporing and non-capsulated. Culture: Brucella strict aerobe. Brucella abortus is capnophilic, requiring 5 to 10% carbon dioxide for its growth. The optimum temperature for the growth is 37 degrees centigrade. They may grow on ordinary medium, though growth is slow and scanty. The growth is improved by addition of glucose, serum, blood, or liver extract. The medium employed for culture or serum dextrose agar, serum potato infusion agar, tripticase soy agar, or tryptose agar. The addition of bacteriocin, cyclohexamide, polymyxin B, or vancomycin makes these media selective. On solid media, the colonies are short, moist, and translucent. In liquid media, the growth is uniform. The cultivation in presence of dyes. The three important Brucella: Brucella abortus, Brucella melintensis, Brucella suis are differentiated on the basis of their ability to grow in the medium containing alanine dye such as basic fusion 1:50,000 and thionein 1:25,000. The Brucella melintensis is not inhibited by any of the dyes, while Brucella abortus is inhibited by thionein and not by basic fusion. The Brucella suis is inhibited by the basic fusion and not by thionein. Biochemical reaction: no carbohydrate or ordinary fermented, but they possess oxidative capacity. They are catalase and oxidase positive except for Brucella neotome and Brucella ovis, which are negative. Urease negative, nitrate reduction, urease positive, nitrate reduction positive, indole negative, citrate negative, MR, VP negative. Urease test is very rapidly positive, particularly in Brucella suis, which is positive within 30 minutes, and Brucella abortus takes 1 to 2 hours to become urease positive. Antigenic structure: two main somatic antigen of Brucella, A and M, are present in different amount in the three major species. Antigen A is dominant in Brucella abortus and antigen M is dominant in Brucella melintensis. Brucella suis has a intermediate antigenic pattern. The abortion of minor antigenic component of antiserum will leave most of the major antibody component. Such absorbed A and M monospecific sera are useful for identification of agglutination test. Biotype: Brucella abortus 7, biotype 1 to 9, number 7 and 8 are deleted. Brucella melintensis 3, biotype. Brucella suis 5, biotype. Brucella suis strain which produces H2S are called American strain, and those not producing H2S are called Danish strain. Forge typing: the Tbilisi TB refers Forge is used for forge typing. Classification: Brucella may be classified into 6 species based on carbon dioxide requirement, production of H2S, sensitivity to aniline dye, basic fusion, and thionein, agglutination by monospecific sera, and forge lysis. This is all three major species of Brucella are pathogenic to human being. Brucella melintensis is the most pathogenic species, followed by Brucella suis of intermediate pathogenicity, and Brucella abortus is the least pathogenicity. Brucella suis is a zoonotic disease. Mode of infection: the Brucella are transmitted to human by drinking contaminated, unpasteurized raw milk or by ingestion of milk products from the infected animals. Direct contact with infected animals tissues, butchers, dairy workers, farm workers, and veterinarians are particularly at risk. Accidental ingestion, inhalation, injection, and mucosal or skin contamination may occur in laboratory personnel working in Brucella. Type of infections: human infections may be of 3 types: subclinical or latent infection. There is no clinical evidence of diseases, but is detectable only by serological test. Acute brucellosis: it is also known as undulant fever or Malta fever. It is associated with prolonged bacteremia. Chronic brucellosis: it is usually non-bacteremic. The symptoms are generally related to the state of hypersensitivity. Cause of diseases. Brucellosis is primarily a disease of a reticuloendothelial system. Brucella has special predilection for intracellular growth, especially inside the phagocytic cell. Cell-mediated immunity plays an important role in recovery from the brucellosis. The incubation period varies from 2 to 3 weeks and may extend to 6 months. Acute brucellosis is characterized by fever, chills, shivering, malaise, severe headache, bone and joint pains, mild lymph node enlargement, and sometimes hepatosplenomegaly. When the disease persists for 6 months or more, it is termed as a chronic brucellosis. The disease is worldwide in distribution. In India, Brucellosis melitensis is the predominant pathogen of human brucellosis, acquiring from the goat or sheep, which is followed by Brucellosis abortus or of cattle origin. Laboratory diagnosis. The brucellosis is a febrile disease with varied clinical manifestation. The laboratory method includes culture of brucella, serology, and hypersensitivity test. Specimen: blood, bone marrow, liver, and lymph nodes. Blood culture. The blood culture is the most definite method for diagnosis of acute brucellosis. Blood is collected during the pyrexial phase because chance of positive blood culture are more during the period. 5 to 10 ml of blood is inoculated into 550 to 100 ml of serum dextrose broth or trypticase soy broth and incubated at 37 degrees centigrade aerobically in presence of 5 to 10% carbon dioxide. The subcultures are made on solid medium every 3 to 5 days for 8 weeks and incubated. The need for frequent subculture can be avoided by use of a Castaneda method of blood culture. It contains both liquid trypticase soy broth and solid trypticase soy agar media in same bottle. The blood culture are positive in 30 to 50% of cases, even when repeated samples are tested. Backtech is a rapid method for culture and become positive within 5 to 6 days. Identification: it depends on biochemical test, dye test, agglutination with monospecific sera, and lysis by Fudge. Serology. The serological method are more useful as culture are negative in high percentage of cases. The antibody IgG and IgM appears in 7 to 10 days after clinical infections. In chronic brucellosis, only IgG can be demonstrated and IgM may often be absent. The agglutination test identifies mainly the IgM antibody, while both IgM and IgG can fix complement. The agglutination test is usually positive in acute infections but may be negative or weakly positive in chronic cases. Serum agglutination test. The serum agglutination test is the most widely used test for diagnosis of brucellosis. This is the tube agglutination test in which the equal volume of serial two-fold dilution 1:20 to 1:640 of patient serum and is standardizes antigen heat killed brucella suspension and mixed and incubated at 37 degrees centigrade for 24 hours. A single titer of more than 1:160 is a presumptive evidence of a brucella infection. Agglutination titer are expressed in international unit. Castaneda strip test. A loop full of patient serum is placed on a filter paper strip containing a colored brucella antigen. The antibody is able to fix the antigen and prevent its movement along the paper. Complement fixation test. It is most useful in chronic cases as it detects both IgG and IgM. ELISA and RAA. These tests are very sensitive and helpful to distinguish acute and chronic brucellosis. ELISA can detect IgM and IgG antibodies separately. Indirect immunofluorescence test. It may be positive even when agglutination test is negative. Hypersensitivity test. Brucellin test. It is delayed type 4 hypersensitive to brucella antigen. It is an intradermal test using protein extract of organism called brucellin. The positive reaction is indicated by an erythema and induration of 6 mm diameter within 24 hours. The test may be helpful in chronic brucellosis. Persistent negative skin test helps to exclude brucellosis. Detection of animal infection. The method used for the laboratory diagnosis of human infection may also be employed for the diagnosis of animal infection. The culture of milk and urine may give positive result. For identification of infected animals in dairies, beside culture, the pooled milk samples may be tested for antibody by milk ring test.